Welcome everyone to this year's Parish, Town and Community Councils Conference. The theme is all around affecting change at a local level and seeing how we can support an ageing population. To introduce the webinar, I wanted to give you a little bit of a rundown of what a Teams webinar and how it works, because this is our first time delivering a Teams webinar, so please forgive us if technology is a little bit tricky. But everyone will remain muted throughout and your cameras are off, so we can't see you and we can't hear you. But you can use the chat function, so please do use the chat function and introduce yourselves today. There's so many common themes in terms of attendees, so there'll be some great connections to be made. There also is a Q&A function, and within the Q&A you can ask questions. I'd recommend when they come to put them in there straight away, because if you're anything like me, they'll fall out your head as quickly as they've come into it. And we're going to try and answer questions at the end of the presentations. We have a slot for like a panel discussion, but anything that we can't answer live, we will respond to after the event. But do fill and flood the chat and the Q&A function, please. The webinar is being recorded and we are going to be sharing it with everyone who's registered. We'll also put it on our website as well so that people can access it that way. And at the end of the event, there'll be a link to complete the post-event survey. As I said, this is the first Teams one that we've done, so anyone's feedback in terms of how they found the technology and what they thought of the event as a whole would be most appreciated. Something that's coming up later on is a Kahoot quiz. So you don't have to worry about this right now. I just wanted to let you know that this is coming up. So a Kahoot quiz is an interactive quiz that you can do using your mobile phone or your laptop, but it's significantly easier on a mobile phone, I would say. And you go to www.kahoot.it, and when we get ready to do the actual quiz, my colleague Tanya will share her slides and you will see what number you need to type in. So it gives you a little PIN code, you type in the PIN code, and then we will all be on the Kahoot quiz. So that's coming up later on. I just wanted to give you a heads up so you can get your phones at the ready. In terms of the agenda for this morning's conference, we've got such a good range of speakers. So first of all, we're going to be joined by Jonathan Owen, who's the Chief Executive of the National Association of Local Councils. We're really grateful to have him with us today. And then we've got Annie Brewster, who is the High Sheriff of Hertfordshire. She was inaugurated a week or so ago, and she's going to tell you all about what her plans are for the year. We've got our quiz, and we're going to learn from Suffolk Fit Villages, which is a fantastic programme taking place with our partners. And then Annie Holden is joining us from the National Active Partnerships. We've got Professor Samuel Gray also joining us. I'm going to talk to you about Live Longer Better in Hertfordshire and what services are available to you as an organisation. And we've got a champion, Anne Barker. There's so many Annes and Annies on this call. I'm really sorry if I stop all over people's names, but we've got champion Anne Barker joining us. And she's going to tell us what how she's used the Live Longer Better in Hertfordshire revolution to help her Datchworth Parish Council. And then we've got Richard Sutcliffe, who is the Director of Funding for Sport, and he's going to explain how he can help organisations to access national funding to deliver some active ageing activities in your communities. But I thought it might be useful to start off to learn a little bit more about Heart, Sport and Physical Activity Partnership, because I appreciate this might be unfamiliar to everyone. So I'm going to hand over to my manager, Will Slemmings, who is the strategic lead for health at Heart, Sport and Physical Activity Partnership.
Yep, thank you, Charlotte. So a couple of very quick slides from me, just as Charlotte said, if you haven't heard who we are and what we do at the Heart, Sport and Physical Activity Partnership, most people abbreviate us to HSP, so you might know us that way. But essentially everything comes back to our vision, which is we are seeking to get more people more active more often. And everything that we do should have that laser line sight back to how are we using it to tackle inequality and disadvantage in whatever respect that inequality and disadvantage may be taking in that situation. So we've been around for a little while now. We had our 21st birthday recently. So we're established in 2003. We're what's known as an active partnership. So we're a part of the active partnership network across the country. There's 43 versions of us, but we are the Hertfordshire version. If you're living on the borders of Hertfordshire, you might also have contact with Active Essex, obviously in Essex, or Be Active in Beds, or London Sport going further down. So there's lots of different versions of us, but HSP are the Hertfordshire Active Partnership. And if we'd been presenting sort of 10 or 15 years ago, we'd have been very much in the delivery space. So we'd be employing instructors to go out and deliver classes in the village halls, in the parks. We're now very much in the enabling space. So we exist to try and help other people, to help people to be more active. We create the conditions, we try and remove barriers, and we work with that wide range of stakeholders, partners and organisations to do so. We're core funded by Sport England, as well as drawing some core funding from all of our district and borough local authorities. And we are based at the University of Hertfordshire in Hatfield. We've got approximately 40 staff, and it seems to be constantly on the up at the moment. We're a growing team, which is brilliant. And we cover lots of different areas within HSP. Myself, Tanya and Charlotte work in the health team, along with some other colleagues as well. If you could pop onto the next slide, please. And this one, I'm not going to go into loads of detail about because there's loads on there. But when the slides are circulated, you might be interested in reading a little bit more about it. The main thing I want to talk about is our long-term mission, really to drive home what it is that we're doing. So that bit with the target and the arrow there. So we're working strategically and collaboratively to improve the lives of people in Hertfordshire by using the power of sport and physical activity to tackle inequality and disadvantage. And as I've mentioned, we do that in all sorts of different ways, but we do have 6 core strategic objectives. So that's around supporting the sector, helping the county and its residents to recover from the effects of COVID, which are still very much being felt in many different ways. How we can use physical activity to benefit people's health and well-being. How we can use sport for social change. So in addition to the health benefits, it could be to benefit employment, or it could be educational attainment, or any other social aspects that might be able to be improved by using sport and physical activity and movement. We want to build stronger communities. We've got a really good place-based project across the county, and in essence, that's exactly what this call is about today, is about how we can use physical activity and movement in place to benefit local communities. And also around active environments. We know we've got a big part to play in how we can affect the planning system to build in the ability for people to be active, but also encourage people to be more active in their environment as well. So that might be encouraging more active travel rather than using the car, and using the pathways and the bridleways and everything else that comes with it. So that's a real snapshot of who we are at Heart Sport and Physical Activity Partnership. We'd love to carry on conversations with anyone that wants to sort of beyond this call. And there might be specific bits that pique your interest, or there might be bits on this slide that actually we don't cover today that you'd like to speak on more. And all the contact details will be shared following the event if you do want to get in touch and talk a bit more. I think that's me, so I'll hand back to Charlotte.
Thank you, Will. So our first external guest today is Jonathan Owen, the Chief Executive of the National Association of Local Councils. And Jonathan has extensive experience working in governmental and parliamentary areas. And we are very, very lucky to be joined with him today. So thank you so much, Jonathan, for taking time out of your very busy schedule and joining us. So I'm going to stop sharing my slides to allow Jonathan to share his, and he's going to tell you all about health and well-being at Place. I'm really sorry, you're muted.
Good morning, everybody. That's good to get that one out of the way straight up. But thanks, Charlotte, for invitation to this really important event. And it's great to see so many people attending it as well today from across Hertfordshire. That's absolutely excellent. And just goes to show how brilliant parish and town councils are in Hertfordshire. I'm on a call from a very chilly but very sunny Suffolk, and hopefully we'll get a bit of warmth coming through soon. I've got a few slides to share, which I'll go through in a minute, but I guess I would want to get across 3 key messages, and then you can just go off and make a cup of tea and not bother to look at the slides. But firstly, as a society, we must do something to promote active aging. It is one of the big issues facing the country and many parts of the world, very similar to climate change and other things. So as a society, we need to mobilise to promote active aging. Parish and town councils have an absolutely key role to play in that. And the third point is that to really fulfill the potential of parish and town councils, you need to work in partnership with each other, with other tiers of government, and with other organisations. So I'm just going to run through a few slides quickly if I can.
That's great, Jonathan. They're showing.
Thank you. So I just thought I'd briefly outline a little bit about the National Association of Local Councils. It represents about 10,000 parish and town councils across the country and 100,000 councillors. When you think about that, that's a huge resource, a huge number of people getting active and volunteering in their local communities and making a big difference in so many ways. They contribute around about £2 to £3 billion to local communities. That's not huge in local government or public sector terms, but when you realise that money is spent on the ground in very tangible projects, then you can see how important it is to communities. We work closely with 43 county associations, and you won't be surprised to hear that the Hertfordshire Association of Parish and Town Councils is one of our best. And Karina Helm, I think, is on the call, and I'm sure she'll have a lot to contribute to the health and wellbeing agenda. Parish and town councils cover about 30% of the country, but they're growing. They're being set up in more and more places, in urban as well as rural areas. Districts and unitaries are having financial difficulties and are looking to our sector to pick up many discretionary services, many of which help to promote active health, good health and active aging. And I think parish and town councils have the potential to be at the heart of place shaping, helping develop partnerships and helping make the country healthier. This all sounds pretty daunting, but actually there's plenty of help out there too from the Hertfordshire Association and from the National Association and from other bodies as well. The theme of this conference today really is a bit of partnerships, and I thought I'd just draw up a slide which flags up some testimonials from a number of national organisations which really recognise the role of parish and town councils in helping bigger councils, the health sector, police and other organisations fulfil their responsibilities. So, I think you parish and town councillors and clerks in the room, go and knock on the doors of those other partners and say, we're here to help, we're ready to help, and we need your support as well. So partnership working is very important. In terms of ageing, and I'm sure others on this call will be far more expert than I am in this, but this is a report that came out for the Centre for Ageing Better at the tail end of last year, I think. England has an ageing population with more of us living longer than ever before, with something like 20 million people aged 50 or over. And they comment that our society and our policies need to change now to keep up with this radical shift. And that's why I think parish and town councils have such a really important role. Those graphs that you can see on the screen, which are quite small, and hopefully the slides will be circulated separately, but in essence, they demonstrate really that over the next 50 years or so, the number of people in the older age ranges are going to be much larger than they are currently, whereas the numbers in the lower age ranges remain pretty much stable. So that's really the challenge for us, and I believe parish and town councils can play an absolutely key role, and that's why we're working with organisations like the Centre for Ageing Better to promote age-friendly communities, including in Banbury, Framlingham in Suffolk, St Ives and Yate. And they have a network of age-friendly communities, and there are 79 members of that network. And you'll see the yellow highlighted ones are parish and town councils. And I understand that Stevenage and Hertfordshire are involved in that initiative too. So I'm sure they're working with HSP as well, and will provide some help and support to you to help your communities age better. When we think about health, all too often we think about ill health, don't we? But actually, and medical intervention to cure ill health. But actually, as the King's Fund pointed out back in 2019, it is just as important to create healthy places to promote healthy living so that people do not become ill or sick. And that slide there just outlines a number of ways in which you can promote good health. And you'll see from that so many of those elements are actually right up the street of parish and town councils, including things like green spaces, helping with transport, developing strong social environment and neighbourhood planning and other things. So it's important to see a parish and town council's role as being developing positive health. And I think that's quite a good corrective, because sometimes when I talk to parish and town councils, they say, well, we don't want to take over the National Health Service. We're not in the business of that. But actually, when you look at the things that you do, you're already doing health and well-being, whether that's a provision of allotments, outdoor gyms, leisure centres that some of you will have taken over from upper tier councils, parks and open spaces, huge number of trees that you look after, skate parks, grants to voluntary organisations, promoting volunteering, getting involved in social prescribing, using neighbourhood plans to create healthy communities, and working to develop age-friendly communities as well. So that's what you do, that you don't need to be intimidated by that, by getting involved in health. It's just a different way of looking at what you currently do. And all across the country, parish and town councils are getting involved in the health and wellbeing agenda. I'm sure you'll have huge numbers of examples in Hertfordshire. I thought I'd just show a few case studies that the National Association of Local Councils has collected as part of its web pages to provide support on health and wellbeing. And that includes councils in Cornwall, working with the voluntary and community sector to reduce isolation and loneliness. And loneliness is one of the biggest health threats, actually. I think I read somewhere that it potentially kills more people than cigarettes. In Cambridgeshire, Milton Parish Council has a community warden scheme. 5 very small councils in Devon are coming together, working in partnership to promote dementia-friendly communities, and they've employed a kind of project manager to support that work. In Northumberland, again, tackling loneliness. In Owdham, in Cheshire, they've set up a carers respite scheme. So someone with caring responsibilities can get some time to look after their own health as well. And it's not just parish and town councils that are getting involved in the health and wellbeing agenda, it's the county associations as well. And so Essex County Association has set up mental health first aid training for parish and town councils so that they can help members of the public realise if they're in risks of getting into ill mental health. All this material is available on our website. I'll put a link to that into the chat later. And we have a number of supporting information on how you can help create healthier communities, tackle dementia, recognise the challenge of epilepsy, get involved in your local health watch schemes, tackle loneliness, and work on mental health as well. So there's lots going on across the country, lots of support, and I'd really encourage you all to think how you can help your communities to age friendly and to become healthier and better. And then finally, I think just a plea to look after yourselves as well. You know, mental health is one of the biggest challenges facing us, I think it would be fair to say, and it's something that we should all take personal responsibility for. And many councillors and clerks have really quite stressful jobs. So do take time in your role as a councillor or a clerk to make sure you're doing things like talking about your feelings, keeping active, eating well, drinking responsibly, keeping in touch with others, taking a break, and caring for others. And that leads me, I think, to my final point, really, which is we live in quite challenging times, really, with quite a lot of social media causing problems. A lot of councillors and clerks are facing quite a lot of, uncaring comments from other members of the public or other people they work with. And we've launched with the Society of Local Council Clerks a civility and respect pledge to encourage people really to be kinder and nicer to each other. And I'll put a link in the chat to that and encourage you to think about signing it. I think good health begins, with yourself, making sure you are healthy, but then starts at a local level by building healthy places, by having green spaces, lots of trees, neighbourhood plans that support this agenda, and a range of other things. So I think it's a hugely exciting time for parish and town councils, and I would really encourage you all to learn from this event and really take it away onto your patch and see what you can do to help make your communities healthier. Hopefully that gives a brief outline of why I think this issue is so important, why parish and town councils have a key role, and why partnerships are so good. So thank you for this event. I hope it goes well. I can say for some of it, but I will probably drop out at some point if that's okay. But thank you very much, Charlotte, for inviting me.
Thank you, Jonathan. No, I think those points come across so well, and I think the importance of partnership is something that we take very seriously and consider a lot at Heart Sport and Physical Activity Partnership, because we don't do anything in isolation. It's making sure that we know the experts on the ground as well, because the town and parish councils are going to be the experts in their areas, which is why they're such a vital partnership for us. So totally agree. And in terms of the age-friendly communities, you're right. So we're really fortunate. Stevenage are the first town or local authority area. Unfortunately, age-friendly communities don't go down to the parish size, but they can be enveloped within a larger area, but they are the first one in Hertfordshire, so we are working with them, and that piece of work is going to be led by Age UK Hertfordshire, and we do have a couple of colleagues from Age UK Hertfordshire on the call, so we can definitely link people to them after the event if people are interested in age-friendly communities. And we will include in the post-event survey an option for people to opt in to having their contact details shared with attendees, because that's been mentioned in the chat. And I think that's where partnership blossoms. So thank you so much, Jonathan. Really appreciate your time. So if I go back to my slides, I wonder if it doesn't start where I left off. I'll try and work out how to get it to start where I left off next time. Following on from Jonathan, we have the wonderful Annie Brewster with us today. Now, Annie Brewster is the High Sheriff of Hertfordshire. She's a former councillor and mayor for St Albans. She's the current long-standing board member for Heart Sport and Physical Activity Partnership, and she was also the chairman for Herts County Council. So she's got such an accolade of responsibilities and experience, and she's got a fantastic hat now to show you as part of her High Sheriff role. So thank you, Annie, for joining us. We're really looking forward to hearing about your year for sport.
Thank you. I hope you can hear me. Good morning, everyone. I'm excited to be here. Sorry, I've come up as Paul. I've had to move into the study on his machine, but I am Annie. And you're absolutely right. I became High Sheriff last Wednesday. So it's been a wonderful week already. I'm probably setting a first to wear a hat during a Zoom call. I did attend a reception at Buckingham Palace once, and the Queen came round right at the end and had her crown on, and it made me laugh so much. She was in her own house wearing a crown. But here we are, I'm in mine wearing my hat. But as you hear, I've had a lot of experience as chairman of the county council, mayor of St Albans, a county district and parish councillor. And I believe, and I say this everywhere I go, the most important level of government is town and parish levels. It's where we make things happen. It's where we deliver. It's where we understand what our residents really want. And I would love to find out what you're already doing, particularly for the older population. And I want to talk about how we can help you to do more. So High Sheriffs are allowed a theme, and quite often they're quite depressing. They'll be around drugs and alcohol or knife crime. But having had so many years of potholes, I wanted to do something a bit more exciting. So my theme is sport for good. And that's everything from the desistance of crime, but right through to mental health and well-being, educational attainment, work attainment, social engagement, but getting hearts moving, particularly post-COVID. For some people, the longest walk, even now working from home, is to the fridge and back. So what are we going to do to try and help people to do more? Today, you're going to hear about some funding initiatives, some wonderful ideas where you can get up to £20,000 bid to help with some of the things you'd like to do, and a free offer of bid writing from the partnership to help with your ambitions within this Olympic year. Now, I was just going to share a slide, if the girls can put it up. At my declaration last Wednesday, my oldest guest was a gentleman called Flight Lieutenant Colin Bell. Now, Colin was a mosquito pilot in the Second World War and did lots of missions over Germany. He's recently abseiled 17 stories down the London hospital and even did a sponsored walk a little while ago. And wait for it, he's 103 years old. And there's no walking stick, only glasses when he reads, life and soul of the party. But the thing about Colin, if one asks his the reason behind this, one of the things is he walks everywhere and he's very sociable. And what's wonderful about Colin is that he makes everybody in a room feel not only young, but they've got decades ahead of them of good quality life. And it's a good quality life that we're looking to try and help for all reasons, best for society, but also for our healthcare and everything else. So last Tuesday, I visited one of our free Hertfordshire health walks. Now, these are probably very near you. They start very gently. There's a first steps walk opportunity, and then many graduate up to even 5 miles. And one of the leaders I met last week had been a stroke victim. That's how they'd come to it. And I spoke just before they went off about how young people who've had a trauma in their childhood pretty much turn into addicts of some description. And those addictions can be really harmful: alcohol, drugs, gambling, overeating, undereating, all those sorts of things. But actually, being an addict, one's always an addict, and being able to turn that addiction into some physical activity, it actually is the most wonderful thing. So the younger we can get people, there's still a chance later on as well. And a lady came up to me afterwards on the walk and said, "You've just explained my life, basically." She was a recovered alcoholic who has improved since health walks. And I asked what her trauma was. Her father had died of cancer when she was 5, and suddenly the whole thing made some sense. And so it's incredibly exciting how all these pains in our childhood can be addressed by getting physical. So another thing I did on Friday, I visited one of the strength and balance classes in Cottonmill in St Albans. And most of it was seated exercise. I'm sure some of you are already doing this in your villages and towns. But I have to say, despite having a world bronze at race walking, I was really stiff the next day. I was amazed at how effective these exercises are, particularly for ankles and hips, and absolutely tremendous. Most of the beds in hospital are orthopedic beds from falls of hips and whatever. So that's a fantastic thing to do. This weekend, I'm visiting 2 of our free park runs. Again, they'll be near you. Don't have to run, can actually walk them up to 5K. So that's a tremendous thing to be able to do. And all these things that you're already doing, I hope they're all logged onto the partnership's activity finder, because in that way, then people can find out where they go. So if you'd like to run more or help with whatever you're running now, please get in touch with the partnership, because you're going to hear a little bit more about that later on in the initiatives that you can start. An example in my own village, and I know we've got Julia Warren, hello, from Wheat Hampstead here. About 10 years ago, we asked, this was more for young people, what they would like in the village. And the one thing they wanted was a 3G artificial football pitch. And with the help of Sport England and the Hearts Football Association, we managed to install one. I think it was £125,000, floodlit, and it has changed lives. The secret of it is it's free for people to go on. The football club come in for 2 hours a night and they get charged, and that goes into a sinking fund to pay for the carpet. But it's quite extraordinary what that has done. The antisocial behaviour has stopped within the village. And I'm amazed that more people aren't actually following this as an example. It's really absolutely wonderful. So my High Sheriff challenge to you all is to see what can you do and what would you like to do in this Olympic year. And I'm really excited to actually hear of your ideas, and I'd love to come and visit you to see what you're doing, and perhaps that's something that we can organise, and maybe even come and do a bit of filming and see what you're up to. So this is my challenge, and I really hope that together we're going to get Hertfordshire moving, and or moving more and helping our ageing population. And it's been a delight to be here. I don't know, do I have time for any questions, or do you want to save that for later?
So you do have time for questions if anyone has got something they'd like to ask Annie. Karina, let me see if I can unmute you. There is a way I can do this. Allow microphone. Okay, go for it, Karina. Karina, are you able to unmute and ask the question, or perhaps type it in the chat?
No, I took off my headphones, but I didn't unmute. Hi, Annie.
Yeah,
hi, Karina.
Annie, if you're free this evening, you could have a walk down to us. We're opening up our refurbished pavilion and having drinks at 6 o'clock. For those that don't know, Annie can walk to us, so it'd be great. And we've got various people coming because we have done what I hope just satisfies everything that's been talked about this morning, of creating a place where people can come. We've got a fitness studio, we're going to have a cafe there, we've got better facilities for people using the pitch, we've got beautiful view over the village, and we've really transformed what was a dilapidated football pavilion into something that is going to be used by the community of all ages. So I'm delighted. I'm running around just trying to get all of the drinks and the wine sorted for tonight. But Annie, you'll be very welcome if you're free, you and Paul.
Brilliant. Thank you so much. We'll definitely try and pop down. That's fantastic. That's exactly what we're talking about. And typical Kimpton, they're there right at the front. Well done. Are there any more questions? Or tell us about anything that you're done or you're planning?
I think my reflections from what you were talking about, Annie, is that Colin is the epitome of live longer better, and his mindset, and I feel like we'll go into it slightly more later on, but recognizing that age isn't the barrier often. There's lots of other barriers. It could be presence of disease, or could be social pressures and perhaps ageism, and it could be loss of fitness. But Colin is that epitome where he's very fit, he's got a fantastic mindset, and he's an inspiration to his community. So that was really lovely to hear
something
about.
Yeah, something I wanted to share about Colin. He's obviously a gentleman. You imagine that age group as they are, and he accompanied me to my train. He called the cab, he got in it, he got me to the train, took me on another train to get to my train, went up the escalator, waved me off, and then did the reverse journey. And he was struggling to put the change in his wallet, and I went to help him. And I then thought, no, this is why he's still independent, because it doesn't matter, and it was a good lesson, doesn't matter how long it takes for him to get up and down a step or whatever, let them do it. And I think this is what we want to do, to enable people just to keep moving and do as much for themselves as they can. And even these Meals on Wheels, you know, they've now got these locked, they even got door key fobs, haven't they? So people don't even have to come to the front door. So I think we've really got to watch that. And
you're completely right. I couldn't agree more. I actually, my very first job was a Meals on Wheels delivery driver. And something that was really fantastic during the pandemic was that we were restricted from going into people's houses at the height of the pandemic. Only if people really could not come to the door. And that meant that the majority of people on our round were now getting up to come to the door. And it's a small thing, but it's the small things that add up and make a difference. So I completely agree. Enablement is the essence and the key. And we've had a couple of things come into the chat. So Alex has asked, they've had residents interested in having paddle courts locally. Any opinions on this? It's the fastest growing sport, I understand.
Yes, it's interesting because I did look into in our village to actually do something at the tennis club, and the tennis players were a little bit reticent to actually give up a space. But I think that as more and more people are asking, it's absolutely brilliant. There's paddle, and there's another one which is pickleball. So one needs the harder sides and one doesn't, and they're really inexpensive. Basically, it's a much easier way to play tennis. And one doesn't need to do the overarm serving. It's much kinder on the body. It's really social. It's absolutely wonderful. And I think that actually the schemes you're going to be talking about shortly in terms of funding could easily be covered by that. Often it's just other markings and a lower net, and the paddles themselves are very cheap. So it'd be brilliant to be able to get Hertfordshire moving on paddle and pickleball.
Yeah, I completely agree. We're really lucky, actually. I think this is correct, but I think Hertfordshire is kind of pioneering in terms of pickleball and really helped it to flourish. So we've got fantastic contacts for that if anyone would like us to introduce them. And then we've got Kevin Poulton, who has mentioned the CJ Hearts are running connected community events. I think they've already had one which was really successful. I believe that was in Stevenage a weekend or so ago, and we had some colleagues go along and represent Live Longer Better with badminton. It was really well received. They ended up staying another hour or so to see everyone. But Kevin was just mentioning that there is an event in Harlow tomorrow, and there's an event in Watford on the 5th of May. So if there's anyone on the call in and around those areas that wants to go and find what is available for active ageing and for diverse communities, because that's one of the key themes, and then highly recommend those events, which are free of charge. I understand, I hope I haven't said that wrong, but I think they're free of charge to attend. And it's those sort of community events bring everyone together in the same room, and they're very valuable.
Yeah, I think the CGA do wonderful things, and it's two things. It's one for us to be able to put out the activities that are already there, but the second way is to actually ask your residents what is it that they would like, because that's always the best thing. What does a village or town need? Then how much does it cost? And then how are we going to fund it? To do it that way round, rather than, hey, let's just put this on. And you'll know from your councillors, quite often they've got their own ideas that aren't always the ideas that the residents would like. So I know you clerks are brilliant at this, and any way to devise ways to get out and ask your residents is always the best way.
Yeah, fantastic. And I feel like Councillor Nutkins, who's put a message in the chat, is thinking that way round very much. So they've mentioned that Tring Town Council have got a great youth council and working with the youth council to revamp the basketball court and encourage more people to use it. So certainly working from the perspective of what residents really would find valuable. So
and I think that's really brilliant, Tring. Well done. And I think that's something. The other thing is to do one's homework. I know in Wheat Hampstead, the councillors very much wanted a multi-use games area, thinking it was good value for money, which is lovely, typical thing. But when I rang other parish councils around the country, if they had a multi-use games area and a 3G pitch, the 3G pitch was absolutely packed and waiting, and people were smoking on the Muga. So I think, again, you've got to really do your homework and see what actually fits your requirement within your area.
Fantastic. Thank you so much, Annie. Thank you for joining us. And it's just so great to hear the plans, and I know that Annie is incredibly keen to get out and about and see some of these things in action. So if anyone wants to invite Annie along to a physical activity programme that's running in their town or parish, then please reach out to us and we can connect you with Annie. So thank you so much for joining us today, Annie.
It's lovely.
Next up, we have the Kahoot quiz. So we're going to test your knowledge now. Testing my knowledge to see whether I know how to start this presentation where I left off. And I have a horrible feeling I don't know how to do that yet. It's just loading. Oh, it loves to start at the beginning. Okay, so oh, it did say I could resume. Anyway, so if you could please get your phones out. You can actually click the links on these slides as well. So if you wanted to do it on your laptop, you could click through. But get your phones out and go to kahoot.it. Just whilst this slide is up, I'll hand over to Tanya to talk through. And Tanya, you let me know when you want to share your slide instead.
Fantastic. Thanks, Charlotte. Hi, everyone. Hope you've been enjoying the morning so far. As I say, we've had some really fantastic speakers already and a really good lineup for the rest of the afternoon. So yeah, as Charlotte explained, we're going to be sort of testing your knowledge on Hertfordshire County and its residents. We'll be sharing with you some interesting statistics as well. So I'm just going to get up the game pin so you can actually all log in. So bear with me a second whilst I get that up. Can everyone see that okay? So if you log in to kahoot.it and type in the game pin 1272776, pop in. It doesn't have to be your name, it could be sort of a nickname. And equally, if you do want to come and join along and maybe don't want to do it online, that's absolutely fine. If you just want to grab a pen and paper, you can also do that. But unfortunately, your scores will not count. So if you want your scores to count, I would highly recommend logging in on your phones or online on your laptop. So we'll just give sort of about 30 seconds really just to sort of get everybody in. And Charlotte, do let me know if there's any sort of questions, because I can't see where I'm sharing my screen at the moment on full screen.
No
so if
problem.
anybody's got any questions.
I will let you know if anything pops up in the chat. Thanks, Tanya.
So to give you all a bit of background information, this kind of works like Who Wants to Be a Millionaire? So it will be sort of multiple choice questions. So there'll be sort of 4 answers that you can choose from. And you simply just click the answer that you think is correct. Unfortunately, we do not have £1 million, however, to give away today, so apologies for that. But you do get bragging rights. So yeah, that's always a bonus. So we'll just give it a couple of seconds, and it's also sort of fastest finger first. So you might know the answer, but if you can answer it as quick as possible, you're in for sort of getting some more points as well. Okay. So I'm just going to give it sort of another sort of 10 seconds just to get you all in. And as I say, we're going to sort of test your knowledge today. So just to give everybody a bit of a heads up, that these questions are based off of active lives data from last year. And the new active lives data, I think, was actually released yesterday. But we haven't actually had a way of sort of receiving this just yet. So this just gives us a bit of a flavour, really, sort of from last year. Okay. I think the majority of you are in, so we will get started. Okay. Any sort of anything in the chat there, Charlotte? Should I get ahead with this? I think
you can go ahead, and those not in, feel free to put pen to paper.
Yeah, go to the classics. Okay, so first question. It's going to be sort of a slightly easier one, hopefully, to ease you in. Okay. And as I say, it's all sort of to do with physical activity. So first question, what is the estimated overall population of Hertfordshire according to the census 2021? So is it 874,000 roughly? Is it 1.2 million? Is it 523,000 or 1.6? 5 seconds. It does go quite quick. You have about 20 seconds to answer the question. So you've got to think quite quickly. So yeah, it's a lot of you got that one right. So yeah, it's 1.2 million, and it's actually estimated that there's going to be an additional population rise of around 175,000 by 2031. So that will be on top of that 1.2 million. So it's really important to sort of consider what infrastructure facilities for physical activity is needed in order to sustain a population of that size, really to keep active. Okay, so who have we got at the top of the leaderboard so far? We've got Mark, well done. So next question is sort of delving a little bit more into sort of our senior citizens in the community. So what is the estimated population of older adults 65 plus in Hertfordshire? And obviously we're looking at 65 plus as this is how it's collected in the census and is recognised as a benchmark classification for an older adult. So is it 140,000? Is it 60,000, 34,000 or 208,000? The answer, yes, high majority there is 208,000. Okay. So the next question is we're going to sort of move on to sort of the future really of that age demographic. So Mark's still at the top of the leaderboard there. Well done, Eddie. Second so far. So it's projected that the population of 65 plus in Hertfordshire will increase by what percentage over the next 10 years? So is it 23%, 14%, 5% or 32%? So what is our sort of older adults demographic looking like for the next 10 years? Yeah, so the answer is 23%. So that's around sort of an increase of about 88,000 older adults, which is why obviously it's really important to consider this population growth and its impact really on our communities. So who we got has been, oh, it's a bit of a change round there. I think we've got Sarah is at the start now, bit of a change round. Well done, up to 11 places, the highest climber. So the next question is in relation to the World Health Organization list of the top 10 risk factors for mortality. So globally, physical inactivity is ranked as the what leading risk factor for mortality? Does it rank 4th, 6th, 8th, or 10th? So this is physical inactivity. You've got about 5 seconds to answer. Yeah, so a lot of you know your stuff. So yeah, it's the 4th leading risk factor for global mortality. And I'm going to show you a slide in a minute of the sort of the rest of those rankings. At the moment, we've still got Sarah at the top of the leaderboard there. Well done. So if you have a little look at this slide here, hopefully you can all see it. So yeah, as you see, physical inactivity was ranked 4th. You've got high blood pressure at number 1, tobacco use at 2, high blood glucose at 3, and then at 5 is obesity. So essentially the sort of the top 5 can be potentially linked to the development of long-term diseases such as heart disease, diabetes, and cancers. And the next slide that I've got here, again, is quite shocking, really. So this statistic, so between 3 and 5 million deaths annually can be attributed to the insufficient physical activity. I mean, that's a staggering amount of obviously individuals a year. And it just highlights really the importance of why we need to sort of keep people active and keep people moving. Okay. Next question. So the British Geriatric Society reports that cost of falls to the NHS is more than what every year? Is it 750 million, 500 million, 2.3 billion, or 1.2 billion? This is how much it costs the NHS every year. So the answer is 2.3 billion. So that roughly equates to the NHS spending around sort of 6 million each day on falls related emergencies. So again, yeah, a staggering amount there, as to sort of, you know, how much falls are really sort of costing the UK as a total. We're actually going to move on to the next question, which is more Hertfordshire specific related costs. So we'll go into that in a bit more detail. So Sarah's storming ahead here, keeping her streak at the top. So well done. The next question. So in the year 2021-22, what was the number of emergency hospital admissions in Hertfordshire due to falls for those over 65? Is it 4,608, 3,246, 1,192, or 9,370? So again, sort of delving into sort of Hertfordshire specifics here. So yeah, it's a whopping, unfortunately, 9,370. And around 2,000 of those cases are relating to hip fracture. So yeah, I don't want to be sort of too all doom and gloom about these statistics, but about 10% of people with a hip fracture pass away within 1 month, and about 1/3 within 12 months. So yeah, some really sort of staggering statistics there. And again, this is why sort of it's just highlighting that physical inactivity is a local priority and can obviously be a risk factor for falls as well. So who have we got here? Oh, a few little sort of changes here. It's sort of the top 5 at the moment. It's close. And I just wanted to show you this slide as well, because hopefully you can all see this clearly. But this graph sort of further illustrates emergency hospital admissions due to sort of falls and how Hertfordshire compares to sort of its counterparts at the east of England and the rest of England as a whole. So as you can see here on the graph, the Hertfordshire is the one obviously in green, and we tend to have sort of a higher number in comparison to the east of England and England with emergency hospital admissions. So yeah, there's still sort of a lot that can be done really within our county to improve that. Okay, so the next question is in relation to a study that was conducted by the British Geriatric Society. So a 10-day stay in hospital can lead to what worth of lost muscle mass in people over 80? Is it 1 year, 1 month, 10 months, or 10 years? Five seconds left. Yeah, so it may come to a shock to some of you, but unfortunately it's 10 years, and obviously that's a staggering amount. And again, just really highlights the importance of discharging patients from hospital as soon as possible, as that loss in muscle mass means that they're more likely to rely on long-term social care. They might even sort of have to have lifelong social care. So yeah, we need to sort of find some easier solutions to make physical activity as part of that recovery and rehabilitation process. And of course, preferably prevention is key. So the more we can sort of prevent something like that happening, the better really. Okay, so who have we got at the leaderboard? Oh, no changes really there. So everyone's doing pretty well. Next question. So being physically active can reduce the risk of which following conditions by at least 20%. So is it all-cause mortality? Is it breast and colon cancer, dementia, depression? Is it hip fractures, type 2 diabetes, stroke and hypertension, or is it all of the above? So the benefits of physical activity, how can that reduce your risk? Yeah, so thankfully, all of the above. And I just wanted to sort of show this slide in a minute next, but we'll check out the leaderboard. Oh, a few little changes there with red coming up the leaderboard. Well done. So have a little look at this slide here. So we've said at least 20%, but as you can see here, it can sort of reduce your risk by a lot more than 20%. So for example, the hip fractures there, it can reduce the risk of 68%, sorry. And obviously based on the previous statistics that we've just learned about hip fractures, that's a really positive percentage. It can sort of decrease your risk of depression up to 30%, type 2 diabetes up to 40%. So yeah, the wonders of, it just kind of highlights really the wonders of physical activity. Okay, on to the next question. So what is the minimum amount of physical activity an older adult should complete each week? So this is according to the Chief Medical Officer. Is it 120 minutes a week? Is it 150, 180, or 210 minutes a week? You have 5 seconds. Yeah, so sort of mixed there. And I think, I mean, if you roughly work that out, it's about sort of 30 minutes over 5 days of physical activity. And it's actually in relation to moderate intensity. So that is activities such as brisk walking, swimming, and cycling. So let's see who's on top of the leaderboard after that one. Eddie stormed ahead. But again, it's very, very close. Small sort of score points in between that one. Well done to everyone. Okay. Next question. So what percentage of adults over 65 in Hertfordshire were not meeting that 150 minutes per week of physical activity? So that was those guidelines. Was it 43% wasn't meeting that? Was it 31%? Was it 6.4% or 15%? This is about not meeting those recommended guidelines. Yeah, so it is a staggering 43.6%. And I've got a slide coming up which will break this down actually even further. But let's have a look check the scores on the doors. Oh, don't know what's happened to Eddie there, but you've been pipped to the post on that one. And Sarah's back up to the top there. Kaz, we've got you in second. SBC, third. Okay, so if we just have a little look at this slide here. So this graph shows the total 43.6%. So in blue is actually there's 31.6% of Hertfordshire residents over 65 that are not even meeting the 30 minutes. So that's less than 30 minutes a week. That's 31%, and you've got 12% there, sort of fairly active, but again, not meeting that 150 minutes. They're sort of being more active in 30 to 150 minutes. But yeah, I think that as a total, 31.6% not meeting even 30 minutes of exercise a week can be sort of really shocking. And we've actually broke this down into individual districts as well. So have a little look and sort of see how your district is faring in Hertfordshire. So this is the percentage of inactivity that are achieving less than 30 minutes a week. And again, it's just having a little think really about as to sort of what is going on in your area, as to perhaps maybe why those percentages are looking like they are at the moment. And if there's sort of anything that can be done really to put sort of more provision into the community. Okay. So on to the next question. So this is your final question. So evidence shows that strength and balance programs reduce the risk of falls in the community by how much? Is it 30 to 50%, 15 to 25%, 0%, or 5 to 10%? So this is about strength and balance programs and how it might reduce the risk of falls and by how much. So yeah, it's a staggering 30 to 50%, which is incredible. And yeah, as I say, it just illustrates really the importance that these classes play in supporting our community. We'll check the scores on the doors, but I have a little sort of report to show you actually. But here we go. So if we have a little look at this slide here, this basically comes from, so us at Heart, Sport and Physical Activity Partnership helped to fund strength and balance classes across Hertfordshire. So we've got 14 different classes currently across Hertfordshire. And out of the total attendances, so this actually come from our most recent Q4 reporting for the financial year 23 to 24. So out of 8,675 attendances, this is roughly sort of where those attendances are across the county. And as you can see, where there's slightly higher attendances, so for example, Hemel Hempstead, Stevenage and Cheshunt, that's because there's 2 classes currently running there. So it was on sort of popular demand that we had to put on actually 2 sessions in that area. But I think, again, it's just sort of in light of some of those sort of shocking statistics that we had earlier, just what classes like this can do for the community in sort of reducing some of those statistics. And it's not just sort of the physical benefits, obviously, but equally it's more of the sort of social interaction that older adults are having as well with each other. So yeah, as I say, a lot of these classes, people kind of come to them because they might be due a hip or knee operation. So it's kind of going to help with that recovery process afterwards. We even have some people that have maybe had those operations already and see these classes a bit of a rehabilitation process as well. And as Annie mentioned on the call earlier, she attended one of those last week, and it's fantastic because it can be adapted for all abilities. And yeah, that's what it's all about. But just wanted to highlight to you sort of what those attendance rates are looking like really in the local districts and areas. So obviously, it'd be really great to be able to expand the programme to further locations. So, of course, if you want to see a strength and balance sort of session in your area, then do get in touch with us. But let's see who has won our interactive quiz today. So let's have a look at the podium. So in 3rd place with 7 out of 11, right? Well done, Mark. So 3rd place, and then we've got 2nd place, 8 out of 11 was SBC. And 1st place with a 8 out of 11 is Kaz. Big round of applause to Kaz. Well done. And we've got runners up is Will and Sarah as well. So yeah, I hope you sort of found this kind of interesting to understand sort of the statistics behind physical inactivity and obviously how physical activity can help maybe sort of reduce and minimize some of those statistics. So I'm going to hand back over to Charlotte, and she's going to go through our rural physical activity program with you all. But I hope you enjoyed taking part and learned something today.
Thank you so much, Tanya. I certainly enjoyed taking part, even though I've looked at those statistics before, but they still are surprising. And it's really nice to end on that high, that we can actually make an impact, reduce the falls. And if you do want to expand, then that's something that we're really keen to help communities to do. So a nice example of how this is happening within the community is with in Suffolk. They have something called Fit Villages. So this is kind of an aspiration in Hertfordshire to deliver Fit Villages in partnership with CDA Hearts. We're currently looking for ways for us to fund this type of programme. When you watch the video, you'll see that they are using a centre. We know that not every community has got a leisure centre, but most have a community venue. And this is how we think that town, parish, community councils might be able to play a part in helping people to live longer better. So I really hope this plays without buffering. But if it's terrible, I'll get my co-host to let me know and I will share in a different way. Oops, this slide. Okay, so we wanted to give that as a visual example of how this is working in place and something that we might be able to replicate in Hertfordshire. It's come the time for us to have a little break, a stretch of the legs, and practice what we preach, and not be sedentary. I just wanted to let you know, after the break coming up, we've got Richard Sutcliffe, who is going to be explaining all about the funding offer and how your organisation can access £20,000 free of charge, because Live Longer Better in Hertfordshire has funded his services. We also have Professor Samir Gray, our national leader of Live Longer Better in Hertfordshire. Not in Hertfordshire, because that's not national, of Live Longer Better. And then also we have Annie Holden, who is the strategic lead for health at the National Active Partnerships. So we've got a fantastic lineup after the break to focus on physical activity and how we can actually do the doing. So you've got 10 minutes now. We'll come back at 11:20 to start the second half of this conference. And in the meantime, for those 10 minutes, we're going to play a physical activity session that you might want to do seated or standing. And you can find lots of workout sessions to do at home on our website, movingmore.co.uk, which is Hertfordshire's activity finder. I don't want to impede on your break at all, so go and grab yourself a drink and a snack. I'm going to put the exercise video on, and we will see you at 11:20. Welcome back, everyone. I hope you all enjoyed that little dance break. Maybe had a little mooch around, stretched your legs, had a snack. And we are ready to move on to the second half of our conference. So we've got two very special speakers for Live Longer Better. First of all, we're going to be introducing Annie Holden. And so Annie is a strategic lead for health at the National Active Partnerships. She's got a real passion for supporting people with long-term health conditions to be active and making sure that the sector is inclusive and that organisations and different systems connect up. So Annie's going to give us an overview of how local authorities and town and parish councils can play a part in making sure that the health and well-being of residents is improved in general. So I'm going to hand over to Annie, who's going to share her own slides. I'll stop sharing mine. And thank you so much for being with us this morning.
Morning, everybody. Thank you so much for inviting me. I will share my screen. I presume then that Muir may be coming in after me, Charlotte?
I think so, Annie. He's not here yet, so I think after you. Thank you.
Okay. All right. Let me know first of all if sharing works, because once I do this, I won't be able to see you, I don't think.
I will let you know. We can see the slides, but not quite in presentation view yet, but it is sharing.
Okay.
Perfect.
Okay. All right then. All right. Thank you. So yeah, introduction supplied by Charlotte. Thank you so much. And I suppose I just thought I'd better set the context first of all, really, just for clarity around our network and then our role within the national organisation. So I'm sure many of you are aware that there are 43 active partnerships around the country, and we work in partnership as a system partner with Sport England, who provide some of our core funding. And our work informs, influences and shapes national system and local place approaches to supporting people to move more as drivers for social change. Now, each active partnership are independent organisations focusing on inactive and underrepresented group, and they act as a strategic enabler. They work with a range of stakeholders such as yourselves in the session today, and taking a whole system approach. And we as the national organisation are again an independent national charity of the network. So we don't govern, we don't police, but fundamentally our role is as on the slide here. It just summarises it all really. And primarily our role is to connect, to strengthen and to enable across our network. And from my perspective, particularly therefore in relation to improving health through addressing strategic priorities relating to reducing inactivity levels in areas of need. So Charlotte said, I'm just going to look at this from a wider national health perspective and then to think and to give some examples of how we are then supporting this at a local level as well. So some of these bullet points on the slide here you're all very familiar with. The health context, the crisis that the NHS and social care are currently going through. Life expectancy is stalling, health inequalities are widening, and risk factors are driving significant and unequal burden of preventable disease. People are living longer, but we are living longer with poorer quality of life and with major health conditions. And there is a significant unmet need for the NHS and social care services, which is substantial and increasing. And a lot of these avoidable risk factors, the modifiable risk factors, contribute to significant morbidity in the UK. And fundamentally, the number of years that we are expected to spend in good health will continue to decline. And when you look at that as well in relation to economic inactivity, there are estimates that 2.8 million people aged between 16 to 24 were economically inactive because of long-term sickness. And a longer-term increase in working age people reporting health issues that limit the work they can do. And these pressures of population ageing and the pressures across the health service will play a role in driving up these figures. So just thinking then in relation to specifically from a healthy ageing perspective and looking at those numbers in a little bit more detail. So we know that in 10 years' time, our ageing population will increase to around 22% of the total population, and 2/3 of adults will have multiple long-term conditions by 2035 and more likely to experience mental health problems. The number of years expected to spend in good health will decline, and specifically in the most deprived areas, people can expect to live more than 17 years more with disabling health conditions. And then what's shocking is when you overlay that with some a recent report that came out from the Health Foundation last year that said, yes, we are living longer, but the number of 20 to 69-year-olds, our working age population, is only projected to grow by just about 4%. And that's the group that generates the bulk of the government revenues, including across the NHS. So we need to significantly rethink how to manage the pressures within our health and care system. In order to support and enable and empower our healthy, active communities. And if we look at physical activity a little bit more closely, not forgetting that physical inactivity in itself is a significant risk factor, and the Global Burden of Diseases UK analysis from that said that physical inactivity and low physical activity is the 4th leading risk factor contributing to deaths and the burden of disease globally, ranking ahead of overweight or obesity. We know that estimates of physical inactivity contribute to almost 1 in 10 premature deaths from coronary heart disease and 1 in 6 deaths from any cause. And the cost to the UK is £7.4 billion annually, and that's 0.9 billion to the NHS alone. So there's significant reasons as to why we should be looking more closely at what role physical activity can play. And if you look at it through the lens of musculoskeletal conditions, and we know there's a huge amount of our population, 20 million plus people have an MSK condition, such as arthritis or back pain, and that significantly impacts on their quality of life and their independence. And you can see from the infographic on the slide here that we know that regular physical activity can help reduce hip and knee pain, joint and back pain, falls, etc. And that really over half, if we look at that last comment on the bottom of the infographic, over half of people said with MSK conditions said that their pain, fatigue and dexterity were a significant barrier on their ability to physical activity. So whilst we look at the context of health in relation to NHS, we should also look at it, obviously, through the lens of the individual themselves. And a report that's just recently been launched, and I'm sure many of you have seen this from the Richmond group of charities, Bridging the Gap, looking at the patient's perspective. And whilst the vast majority of those patients who are living with long-term chronic diseases and disabilities know that physical activity is important, they also know that the NHS is a trusted source, but that is only the starting point. There is only so much the NHS can do, and they're not that lifelong partner either, nor should they be. But the top 3 barriers to being active, not surprisingly, were pain, lack of energy, too tired, and their own physical limitations. So whilst we're thinking about how to support our communities from a wider health organisational perspective, clearly we need to have very much a person-centred approach on this. So I'm sure I don't need to tell you overall the benefits of being physically active to the NHS and to our communities. And reducing inactivity could prevent up to 40% of these long-term health conditions, and physical activity can help to manage more than 20 of the most common and mental health conditions. Therefore, doesn't it just make sense that physical activity should play an essential role in primary and secondary prevention? Because not only will it help reduce the pressures from a primary care and an acute hospital perspective, but it will also help and support individuals to self-manage, a very untapped area of our health service. But we know that physical activity remains chronically underutilised within NHS care and population health management. So coming back to our network and working with our national partners, our ambition is for physical activity to be framed as a core part of our health and care systems, enabling an integrated approach to prioritise physical activity, not an afterthought, but very much alongside routine care, recognising physical inactivity as a key risk factor for poor health. So that's the status. That's what we think we should do. But so what? What exactly are we doing about it? Well, nationally and locally, there are an awful lot of opportunities and perhaps challenges. And by that, I mean, sometimes there are an overwhelming number of opportunities that can think, well, where does physical activity and our network and those providers of activity, where are we best utilised to offer our services to support our population? Well, the answer is very different across different areas, as you will know from your own area. But coming back to the role that I play in working with Active Partnership and Network, as well as then with those national organisations, our role is to bridge that gap. And the only way we're going to overcome the silo working and to shift it more through that person-centred approach is to ensure that we work in a more connected and a collaborative way in order to have that integration, physical activity into health and care systems. So let me just give you a couple of examples just to finish off my session here. So some of you may be aware of a consensus statement, which to us in the physical activity world was the best thing since sliced bread. You know, a publication, a scientific review of all of the evidence that was has been scientifically published and looked at the risk of people living with long-term health conditions being physically active, and fundamentally the benefits outweigh the risks. So this was part of a systematic review. Samir was part of this as well. So us as physical activity enablers and providers thought this is brilliant. And then, of course, you realise actually there are some unintended consequences from this. Locally, we were hearing from our network and from our partnerships such as Within Hearts that there are ongoing concerns about risk. Yes, but if I do this and if I'm feeling this. There was a lack of national guidance on how to set up pathways. There's a disjointed and uncoordinated provision, and there was a lack of consistent advice on commissioning requirement. And there's also confusion on our own sector. If we look at to put the lens on our own workforce sector, there's a confusion on qualifications and what was needed to support clients with a range of conditions. And therefore, this then translates and transmits into our healthcare professionals workforce not having the trust and confidence into promoting and advising people to be physically active. There are a lot of unknowns and so whats and ifs and buts out there. So this is something that we welcome the opportunity to work on, and we've been working with Muir for a good few years now, and always talked about his ambition to have a national activity therapy service. And this is what we seem to be working towards now. So working with Sport England, this aligns to some of their key opportunities for change. So there are the three that are highlighted on the slide, but I just want to focus on the middle one here, because this is where we are working closely with them to look at how to remove those barriers and to have that frictionless pathways, so that we can have a streamlined pathway between health and organised activity. So and that's looking at the pathway specifically, but simultaneously we are working with the Faculty of Sport and Exercise Medicine, who are looking at pre-participation, that medical clearance versus medical guidance, and then also Sport England working and looking into the bigger issue of risk and with insurers and underwriters. So these are three interdependencies we are working synergistically. But just to focus on the pathways and to explain what we're doing here, this is where we, the national organisation, have appointed an external company called Move Consulting, who are partnering with us to look into how we can integrate physical activity pathways into health and care systems more cohesively, removing those barriers. And this is as a result of funding from Sport England that has enabled us to progress on this 15-month project, which ultimately will help people living with or at risk of long-term health conditions to become more active. The aim of this is to outline the information, the guidance, the resources, a bit of a toolkit approach that will help improve access into community-based activity. So Move Consulting with us, with our active partnerships, with other national and local partners as well, are working together on this. And just recently there have been 8 communities of practice that have been established to work in a co-design approach And hearts is one of those. And together we're going to help to unpick those complexities and to help to co-design what this framework might look like. And the ambition overall here is to create an operational framework and resource to support providers to consistently deliver quality assured physical activity for health pathways. And that's the focus on reaching people in the community, making it easier for them to access activity, the right type of activity, and get that individualised support that they need to remain active, independent, healthier and happier for longer. And then, of course, there is Live Longer Better, which is a significant piece of work and really satisfying piece of work. And I've really enjoyed my time working on this with Samir. We've been working with Samir since December 2020. And fundamentally, this is to enable healthy active ageing through a preventative approach. And since December 2020, there have been 30 active partnerships of the 43 that have worked in a very structured way, but very much professionally led and developed by Samir and other colleagues. And fundamentally, the aim of that initiative is to develop that new culture, is to shift from care, from doing to individuals and to enable them. And to do that using activity. And Muir will have probably been slapping my wrist many a time from all the times that I've said physical activity throughout this presentation so far, because he always reminds us that we are beyond physical activity. There is a cognitive and an emotional benefit as well. But that activity is the driver to increase health span for older adults. And this is very much by looking at an upstream, from a preventative perspective. And again, some of you might be aware that Live Longer Better was reported in the recent Chief Medical Officer's annual report, Health in an Ageing Society. And the report reflects our own Live Longer Better mission and objectives. Health and disability in older age is not inevitable. It's about improving quality of life, maximising independence and minimising the time spent in ill health. And of course, in Live Longer Better, in Hertfordshire, don't need to tell you that Live Longer Better is thriving and will continue to do a huge amount of inspirational work in this area. Thank you.
Thank you so much, Annie. And I think it leads seamlessly now into Professor Samir Gray. So I will bring him onto the screen so you can hear about the work that Muir has been doing alongside Annie over the last 4 years now, 3 or 4 years. Muir, I don't know whether your camera is going to work or whether it's not going to work for the meeting, and I can share your slides on your behalf if that's useful at all.
That's great. Yeah, can you hear me?
We can hear you, yes.
Yes. Well, I look like Sean Connery, age 24. So if you can find, that's the simplest thing. Put a photograph up of Sean Connery, age 24, and people will have a clear view as to what I look like. Now, let me see about sharing the screen.
Your handsome face on the slides now, Muir. So to introduce Muir whilst we look at the slides, he is our national lead of Live Longer Better. He is former Chief Knowledge Officer to the NHS and all-round active ageing king. So he's going to introduce Live Longer Better and talk to us about the importance of supporting the ageing population in particular.
Can you see my arrow's diagram, Charlotte?
Yes, yeah,
Good.
that's perfect.
Okay. Well, I'm just going to tell you the facts of life 2.0, what's happening to us as we live longer. So, as Annie said, this aging by itself is not a cause of major problems until the late 90s. 3 other things take place. Disease, but that's mostly caused by the world we live in, not by lifestyle. We've not genetically evolved to live a life sitting down with lots of calories everywhere. And disease is complicated by accelerated loss of fitness. Now, loss of fitness affects us all from about the age of 22 on, when we get our first sitting job. And as Annie emphasised, it's physical, cognitive, and emotional. And then there are social factors. Deprivation and housing problems still affect far too many older people. And all of us are influenced by aging. So, here's what we need to do. And I see the sort of councils that it's great to have this meeting with you people. I think this just is the level for action for the revolution to take place. So we need to help people understand aging, and we have a very good learning program, and we'd like to get all of the councils to nominate 10 people for the learning program, so they could give the talk I'm giving to a bowls club or a bridge club or a WI or a mosque. Then we need to regain fitness, and Annie's covered that very well: physical, cognitive, and emotional. We can still prevent and delay disease, and we need to tackle disease once it strikes. And I speak as someone with 4 or 5 long-term conditions, and the loss of fitness becomes even more important after the onset of disease, partly because other people keep doing things for you. So the son who comes down to Hertfordshire from Leeds to see his mum, and his mum says shopping's a bit difficult, immediately phones up Ocado instead of helping mum recapture her strength and stability. And we need to take action socially, and that's where you guys can do things. So let me just say a word about fitness. And there are 5 S's for fitness I want you to think about: stamina, strength, skill, suppleness, and the 5th S is, terrible joke, but there it is, psychological. So let's just think a little bit of this. So stamina, actually, walking is probably the simplest way to help you with your cardiovascular health, and reduce the risk of type 2 diabetes, dementia, and stroke. It's called brisk walking, just a little bit breathless. Not enough. You can still carry on conversation, but you can feel your breath and your pulse a little bit faster. So here's, I'm working the 2nd edition of my book, and I'd very much like, we can, with Kindle Direct Publishing, we should do a Hertfordshire edition to encourage walks. So all of you can play a key part in promoting walking. Keep the pavements well, put up lots of signposts. A few more benches are good too, for people to take a break if they're on a long walk. So walking, and for that you just use your phone or a Fitbit. And here's an astonishing Gainsborough picture I saw in Highgate. This lady's got a Fitbit on. I didn't touch this up. Isn't that a fantastic picture? So stamina, suppleness. I think we all know there is between mutton and lamb, and there's undoubtedly some loss of suppleness due to the aging process, but most of it is due to inactivity. So stretching classes of some sort, yoga, Pilates, Tai Chi, in every community would be very, very helpful. Skill, again, yoga, Pilates, and Tai Chi. Skill is coordination, and it reduces your risk of a fall. And we now know that at any age, the brain can recapture lost ability. I was taught that after 20, all that happened was the brain cells died off. We now know this is wrong, and at any age, you can recapture lost ability. And you see here, the electric toothbrush allows you to stand on one leg for 2 minutes while you're brushing your teeth. It's a very useful reminder for skill and coordination. And, I've dropped out strength. For strength, again, just starting to think of simple things like, obviously it's very good if you had a somewhere for people who go to lift weights, but at home, people can get 3 or 5 kilogram weights, or I often say sugar is very good for you, providing it stays in the bag. A pound of sugar each side of the sofa, so that every time the advertisements come on, you stand up 10 times, lifting 2 kilograms. So strength, stamina, suppleness, and skill. And I think you councils can greatly promote and support this. Then we come on to cognitive and emotional well-being. And for emotional well-being, we now know that isolation and loneliness is a major risk factor, not only for dementia, but also for depression and anxiety. So there are 3 things that we need to try to do. Firstly, keep the brain tissue healthy. Good sleep, manage stress, and physical activity itself is very beneficial directly on the brain, but also helps with activity number 2, keeping your arteries to the brain healthy. because the same risk factors as for heart disease or stroke. And then fascinating, this third one, increase engagement, positivity, and purpose. And here's the #1 editorial in the Journal of the American Medical Association in 2020, which is always what they pick for their lead article for the decade. And this man's a very distinguished laboratory scientist, but he's not writing about chemicals. Look at the subtitle of this article. It's a prescription, but it doesn't come out of a bottle. Purpose, social engagement, and lifestyle. And again, councils like the ones who are in this room, you're in a vitally important position to be able to tackle the problems of isolation and loneliness. And this I'll just finish with speaking a little bit about purpose, or ikigai, the Japanese call it. And I was with people whose average age must have been mid-80s in a block of flats in Oxford. And what came up in discussion was that one or two of them were helping the local primary school. But I said to them that as a group, it's very good. They do good things for one another. Helping others is vitally important for well-being. But why didn't they adopt the primary school? The primary school is in desperate need of support for teachers, reading support for the pupils, and money. So I think they're going to adopt the primary school. And again, there may be opportunities in your councils for older people to do even more for other people, because that's one way of keeping young yourself. So enough from me, Charlotte and Annie. Very happy to take questions and comments, and a very good mix of people we've got in the room, in the virtual room from the different councils.
Yeah, you're completely right, Mia. We've got such a great, enthusiastic and proactive bunch today. And I wanted to pull on a couple of things that you and Annie mentioned. So first of all, talking about the importance of walking and brisk walking, just to highlight that May is actually the month of walking. So it's going to be a real key focus for us over the next month. And in Hertfordshire, we have the wonderful Hertfordshire Health Walks, which are funded by Public Health. And they have over 100 free walks that happen weekly across the county. They're in every district, and they're always looking to put on new walks. And they are led by volunteers. They are coordinated by the wonderful Claire Pullen, who works within Hertfordshire County Council and Public Health. So Hertfordshire Health Walks are free to signpost people to, and we've got really nice examples of where they start at village hall and end at a village pub. So things like that is what we'd really love to encourage and grow further. And then thinking about long-term health conditions in particular, and I know that someone's put in the chat about their own long-term health condition, and my mum is type 1 diabetic too, and often I think the fear, like Annie was saying, the fear that there might be detrimental side effects to being active, often there's not enough conversation or information to help reassure people that the benefits do outweigh the risks, that you should try and take part in this particular type of physical activity because it's going to be really beneficial for that long-term health condition. So we actually in Hertfordshire, we have run some We Are Undefeatable in Hertfordshire webinars, and we did those a year ago, but they're still recorded and available to watch. And one of the webinars was around being active with diabetes. And it was really interesting because you hear about what types of activity are going to affect your blood sugars differently, and how weight training, for example, might actually increase your blood sugar, and cardio might decrease your blood sugar, and all things like that. So it's just an awareness piece, isn't it? And like Will mentioned, being more aware and connected to the different exercise referral programs that are going across the county. That's something that the health team at Heart Sports and Physical Activity Partnership is actually working on this year in conjunction with our primary care networks. So we would definitely like to help different communities be more aware of what's available locally to them. And just on that note, in terms of long-term health conditions and the fact that Annie said people are likely to live 17 years more, those who with long-term health conditions, if they're in an area that is less deprived, which is why, as a partnership, our mission is tackling inequalities and focusing in on areas of deprivation as well, because those statistics and the difference in quality of life, it's not always just living longer, is it? It's definitely the living longer better, which is what we're really focusing on here. We do have some musculoskeletal hubs, and that's for pain management and musculoskeletal conditions such as arthritis. Now, we've got 3 of those in Hertfordshire, and the main hubs are Westminster Lodge in St Albans, Grange Paddocks in Bishop Stortford, and Woodside in Watford, and they are Everyone Active leisure centres. And all Everyone Active sites have a fantastic programme called Good Boost, and that is around managing pain. So I thought I'd throw that in there as something else that you might not be aware of locally. And whilst it comes to mind another long-term health condition, Grange Paddocks is actually absolutely a gold standard example of being inclusive to people living with Parkinson's. They've got about 180 people signed up to Grange Paddocks who have Parkinson's, and they have Monday to Friday Parkinson-specific exercise classes. So that is now being spread across the other Everyone Active sites. Another little trivia for you is that Everyone Active have a free membership for everyone who is living with Parkinson's and for a carer. So that is something that we would really love to shout about and help more people to benefit from. So that was a bit of like a convoluted way of me summarising those, but I thought that would be useful to know what's happening in Hertfordshire in particular. I'm just looking at the messages in the chat. So Karina's asked, are there any YouTube posts explaining the science and importance of physical activity for the elderly that can be promoted to our residents? I wonder, Mia, I feel like that would be a fantastic opportunity to mention the online Live Longer Better training that we funded.
Yes, that'd be great. We'd be pleased to follow up with you. We sometimes say we've discovered the elixir of life in Oxford. It's called knowledge and consumed by learning, not out of a bottle. So the medical profession is about as much in need of it as the general public, I can tell you. So we need to look at ways in which we can learn. And we are working with a couple of primary care networks to develop this as a standard part of healthcare, is learning what happens as you live longer to help you live longer better.
Thank you. And Mia has created, in partnership with Learning with Experts, which is an online learning platform, a fantastic 12 online lesson training. So they're pre-recorded and you can watch them in your own time. And they are exactly for what you are mentioning, Karina, to explain the science and importance of physical activity and how you can communicate that to individuals. So it's aimed at volunteers and professionals and who we like to call enablers, those who enable people to live longer better. Now, normally that training would be £45 per person to access, but as part of Live Longer Better in Hertfordshire, we have funded that so you can get in touch with us to become a Live Longer Better champion, and we will give you a redemption code so then you can access that training free of charge. We would really love to help more people to access that, because it just boosts people's confidence in terms of having those conversations. And I don't think I've said this to Mia's face, but I tend to explain it as it creates little mini Mias who can go around the county and spread our gospel.
That's what we need. It's best actually if we can get groups of 5 or 10 or 20 to do it, because it's based on the principle that you learn more from other people than you do from the teacher or lecturer. So it's very important to think of ways we can change the culture of what happens to us as we live longer, and to become much more positive about the potential for preventing, delaying, and even reversing many of the conditions that we've previously blamed on aging.
Yeah, absolutely. And in terms of those small groups, 5 to 10 groups, Live Longer Better in Hertfordshire is partnering with the libraries to do some self-help groups all around, like, help yourself to health. And it's that exactly idea that we learn from each other, and being in part of a supportive group can be really beneficial. So we've started a trial in Letchworth at the moment, and we're looking at what place we should bring it next. So if you're particularly keen, you've got a library in your area, then please reach out, because we're going where people ask us to go at the moment with that. I think that's everything. Did Annie or Mia, if you had anything else you wanted to mention from what's been asked in the chat, then please chip in.
No, just like to say thank you very much for coming, and you are very important organisations for living longer better. So thank you for your good work.
Thank you, Mia.
Thank you.
Thank you, Annie. Really appreciate you coming along. So what I will try and do then is reshare those slides. How many times have I done this this morning? Okay, so let's resume. And what we are going to discuss next is some of the core offers that Live Longer Better in Hertfordshire has. So we intentionally do not brand Live Longer Better in Hertfordshire with Heart Sport and Physical Activity Partnership branding, because we recognise we are not the only players in Hertfordshire who are helping residents to live longer better. This is a team Hertfordshire effort. So very intentionally, we leave it neutral branding. We like to call it a movement. It's not a project, because it's not got an end date. And our aim is to use activity, physical, cognitive and emotional, to encourage longer, healthier and happier lives for older adults. And we do that through collaboration and lots of partnerships, echoing back to what Jonathan was saying first thing this morning, the importance of partnership working. We also like to give upskilling and learning opportunities, such as those webinars around how to get active with long-term health conditions or online training. And the ultimate aim is to kind of change culture, one of doing things for others and care, inevitable care, to changing it to enablement and empowering people to live longer, better, live independently, and have control of their long-term health conditions, use it as their strength. We are funded through Hertfordshire County Council. We actually established this in partnership with the public health team as well. So this has been closely developed using the fantastic staff within the adult care services and the public health team. The way our approach, we like to connect our organisations. Perhaps that's connecting an instructor to a local village hall. Maybe it's connecting a resident to their local class that they wasn't aware of. We like to advocate and hold space for physical activity within the different meetings that we join. It could be a dementia strategy meeting, and we like to advocate for the importance of physical activity to reduce the risk and slow down the development of dementia, for example. We convene and bring people together, like-minded individuals. We have, at the moment, around 1,300 members of Live Longer Better in Hertfordshire, and we like to bring people together with events such as today. And then I suppose the final approach is provision. So we provide funding for those strength and balance classes that Tanya mentioned earlier. They are across the county, and we'd love to expand them. And we also provide funding for the bid writer, Richard, who's going to come on later and tell you how your council can get £20,000. Nuts and bolts, kind of what's on offer, that there's quite a lot on here, so I'm not going to go through all of it. But what we will mention is some of our events. You're going to watch a video later on of an event that we ran last year. We run those regularly, and we've got quite a few big events coming up this year. We've got a celebration day in September. We've got a professionals conference in October, and then a health team general conference, health and physical activity conference in December. So busy end to the second half of this year. We have our champions training, which I've touched upon and we'll go into more detail on the next slide. And we've got the bid writing service. So in terms of the champions training, that is the online learning package with the Learning with Experts platform. You learn about enablement, how you communicate the reasons behind moving more being vitally important. And the aim of our champions is that they can sing off the same hymn sheet. They can spread that message throughout their communities and be that advocate. So they might be an individual taking a lead in a certain area, they're making an impact and helping people to live longer, better in Hertfordshire. It could be that it's linked to their job role, or maybe it's just they're really passionate and a volunteer. You're going to hear from a very passionate volunteer in a moment too. So if you wanted to get involved in that training, you can click through on this link and it will take you to our champions page where you can sign up to become a champion. And that information comes through to Tanya and I, and we will send you an email with your redemption code and how to access the online portal. There's 12 lessons, they're pre-recorded, you can watch them in your own time. They're 5 to 10 minutes each. So if you were to binge it like a box set, it would take you 2.5 hours, but you can spread that out over a matter of weeks. We have a post-training survey, and we just want to establish from that the benefits that you found from the training, any plans that you've got in terms of in your work, and also that's where you can claim your Live Longer Better polo shirt, one that I'm sporting now, and then you can represent us on the ground, and the aim is just to help support the revolution. Another useful resource that I think would be beneficial for all areas is movingmore.co.uk. This is Hertfordshire's activity finder. It's a website to improve awareness of physical activity opportunities that are taking place in Hertfordshire. So Heart Sport Physical Activity Partnership, we power that, but it's a standalone website, and you type in your location, or you type in a type of activity and it will tell you where they're happening. So essentially it helps residents find out what's going on. For councils, it helps you to reach your local communities. You can include links to Moving More and specific activities on social media. You might be able to display a poster on a notice board in your local area so that more people know what's available to them. And it also uses something called open data. I don't want to get too technical because I am not technically minded, but open data means that it uses live data and it doesn't get out of date, if that makes sense. So you can be confident that the information that's on Moving More is current and accurate. So what we would really want people to help us with is encouraging more businesses and organisations and people delivering activities to open their data or upload their sessions. It's completely free of charge to do, and we've got lovely team member Lindsay who can hold their hand through that process and help more people find out what's happening, help more people to move more. This is what it looks like if you were to log on. It's about 20,000 activities on there at the moment to explore. But to give you a flavour of the range of activities that communities can get involved with, I'm going to show you this video from our celebration day last September. And I hope you enjoy watching it. And again, I hope it plays nicely. Fantastic. Okay, so leading very nicely on, we do have Anne Barker with us today, who you saw on screen. Now, Anne joined our celebration day last year. She's a really keen member of the Live Long Better in Hertfordshire Revolution, and she's going to tell us about the different types of activities she's been involved with since celebration day, and how she's managed to bring some of those to the parish of Datchworth. And the ways that they've been getting involved. So I'm going to invite Anne now to share her experiences with you.
Thank you, Charlotte. Can you hear me? Good, good. Okay, so a little bit of background. I was a parish councillor at Datchworth Parish Council for 3 years, until May 23 last year. And I'm responsible for health and well-being. And post-COVID, thinking about what we needed for our older adults, and we approached Heart Sports Partnership, and we got funding for Strength and Balance class. I launched it in January 23 last year. A lot of people said, bad time of year to do things. I thought, that's a good time. People will have eaten too many mince pies, might want to do something. New Year resolutions, get fit. I booked a village hall and limited participants of 15, asked to pre-book. On our first session, they were queuing around the block to get in. We had 20 people turn up, even though I'd capped it at 15. Couldn't turn them away. Absolutely fantastic. I had engaged a fantastic trainer specializing in older people, our wonderful Alicia, and we set up a circuit course so that everybody could work at their own ability. And there was a very wide range of abilities. Some people even with walking with 2 sticks, but they were able to adapt the exercise to their abilities. The program is still going strong. Every week there are about 12 to 15 people attending and absolutely love it. And they have they really bonded together as a group. Some people have left for a fantastic reason, because they feel so much more confident now, and they've gone on to other exercise programs, which is really a measure of success, isn't it? And they've been replaced by new people. So we have that throughput, which is what we want to achieve, isn't it? To give people the confidence to say, yes, we can do it. What else can I do now? So that's fantastic. A case study is my husband, who is exercise phobic. In his younger day, he was a very experienced dinghy sailor, but the only exercise he was doing now was clay pigeon shooting. And I got him involved. One of the exercises was balance, standing on one leg. Oh, I've never been able to do that in my life. I can't stand on one leg. Guess what? He's doing it now, and he's telling everybody, I can stand on one leg, and I can hold a medicine ball, and so on. So absolutely fantastic. And we're working with Heart Sports Partnership to try to secure funding to continue the program, because it's been such amazing success, and look at other activities. If I were going to give some tips to local councils, think about your promotion. Your champions are key. You cannot rely on social media for the older demographic, because a lot of them are not even online. So there are lots of, you have to go where older people go, like libraries, etc. And you have to engage your fellow councillors, because you need to have that support and everybody sort of backing that. So I can, if you need to speak to me about hints and tips, happy to oblige. Right, a little bit about me and my journey, how I got here. I retired March 21. I was absolutely exhausted because of COVID. Whereas lots of employers reduced their staff, I had to double my staff because we were providing COVID support, adult careers advice, helping the thousands of people being made redundant. It was just exhausting. I was emotionally and physically exhausted. I retired, looking forward. I'd spent 40 years doing this work, looking forward to a life of leisure and pleasure. But guess what happened? Life throws us curveballs, and it throwed me a curved medicine ball, an enormous one. Because what happened to me? July 21, diagnosed with breast cancer. I spent the next 9 months going through treatment. Anyway, what helped me was walking. Even in the middle of chemotherapy, I walked 9 miles a week with my husband. Couldn't walk with, couldn't join groups because of end of COVID and so forth. I worked 9 miles a week. Got through all the treatment, but were left with joint pain because of chemotherapy. It wrecked my knees especially. I joined an amazing cancer rehab exercise program in Birchwood at Hatfield. And a big shout out to Birchwood Sports Centre. They have been amazing in so many ways. But wrecked with joint pain, joined the cancer rehab, and I'm somebody that I could hardly climb the stairs. My knees were so sore. And I could hardly do the squats. Well, after about 3 months, I could do the squats. And now I'm actually doing squats with leg weights and with hand weights. I then joined Hearts Group Health Walks. I joined the Celebration Day in September. It was just amazing. You heard, I don't have to repeat what I said, but I tried the judo, I tried the Tai Chi, I tried the squash, and echoing what Muir Gray said, you never forget. It's like riding a bike or learning to swim. Well, my goodness, I picked up the squash racket and I was like, I haven't played since I was 21. And it was like being back at university. I went to university in London, I played squash there. And I was like 21 again, rushing around the court. It was just amazing. So anyway, I'm now continuing on the judo, and I've been doing the judo for over a year. Absolutely amazing. I've learned to fall backwards using judo techniques. I've joined the Tai Chi. I'm doing Tai Chi. Joined the revolution as a champion because it's really helped me, and I'm passionate about helping other people. And I've engaged in a whole schedule of different exercises. Monday I do health walk. I do judo. On Monday, Tuesday, I work out in the gym doing strength training. Wednesday, I do Pilates. Thursday, I do a health walk in Tuin. And on Friday, I do Tai Chi. So I'm doing something every day. I've got a whole suite of different activities that help my body and mind. And live longer. Up the revolution.
Viva la revolution. Amazing, Anne.
I've just watched Bob Marley film. It was wonderful. I think of the revolution song.
Honestly, Anne, you are so inspiring. Thank you so much for sharing your story with us. I'm sure all the attendees can just feel how much of a difference all the types of activities has made to you in your life, and you are now bringing that to your local residents. So I just want to say a massive thank you on behalf of HSP and Live Longer Better for being a fantastic revolutionist and champion. And you might have seen, just in terms of like the judo, the falling safely is so important, and reducing the fear of falling as well. And the evidence behind that is staggering. We did do a webinar on that in January, if anyone's particularly interested, or why should older adults be doing judo, or it can reduce your risk of those hip fractures that we spoke about earlier that make such a negative impact on people's lives. So, thank you so much. We really appreciate it, and I appreciate your connection to Datchet's Parish Council, because we're currently exploring a Live Longer Better bid with them to expand the programme. There's so much we can do. So very quickly, I'm going to tell you about another example of things that are going on in the community, and this is with our partners Apex 360, and now they are based in Decorum. Now Apex have become the first Live Longer Better in Hertfordshire hub, and Tanya and I went to visit them a little while ago, and we have got a video to show you. what they have done to become a hub is they've utilised our bid writing service. They offer a programme of live longer, better activities. They've upskilled their staff to be those champions that we mentioned earlier, and they use Moving More. So they're kind of our lovely go-to place where we know we can signpost of confidence. So I hope you enjoyed this video, and you can see another example of community activity. Getting a bit tired of my own face at the moment. Sorry, everyone. But that was a visual example of how it's going over in Decorum. So if you're that way and you want us to send you some more information, perhaps you could share it with local residents so they know what's available to them, and that would be most appreciated. The final thing I wanted to for me to mention was the Live Longer Better Community Award. So the presentation of this award is going to be at the 1st of October Live Longer Better in Hertfordshire conference. Bookings aren't open yet for that, but perhaps a date for your diary. And they're going to be presented by Annie Brewster, our High Sheriff, and you can nominate yourself via a Live Longer by the form that's on our website for the Community Award. So perhaps if you've got something fantastic or an organisation in your area, perhaps Duncan, the U3A, we can make a nomination on their behalf of just to shine a light and say thank you to them for the amazing work that they've been doing. Now, who I think you are going to be very keen to hear from is Richard Sutcliffe. So he is the Director of Funding for Sport, and he has been absolutely phenomenal in helping the community increase their active ageing provision. In just the last year, the last 12 months, Richard has helped us bring £250,000 of national funding into the county, direct to the community to help with physical activity provision. So we are absolutely indebted to Richard, and he's so professional, and his success rate is through the roof. So Richard, I've just kind of set expectations really high, but everyone's going to be very keen to hear about how they can also benefit from your bid writing service.
Yeah, thanks for that, Charlotte. Right,
If you would be
I
able
will
to turn your
try.
camera on, that would be ideal. Perfect. Thank you.
So I've just got to try and find the share.
Oh, I can share them if that's easier, Richard.
Yeah, let's have a look.
Perfect. Yeah, that's showing amazingly.
Okay, do I just need to? Sorry, do I just need to? Is that big enough, or do I just need to?
Yeah, no, that's great for everyone seeing the full slide there. That's perfect. Thank
Right,
you.
brilliant. Right, okay, welcome everyone. Yeah, my name's Richard Sutcliffe from Funding for Sport. Charlotte says been sort of working with Heart Sports Partnership for a long time, but in particular over the last sort of 2 years with the Live Longer Better in Hertfordshire. We've had lots of success, and I'll share some of that successes as we go along. So first of all, I think it's important to mention the there we go. The arrangement that we've got at the moment. So, as part of Heart Sports Partnership, Physical Activity Partnership's contribution to the Live Longer Better in Hertfordshire programme, they basically funded the cost of us to be able to work with organisations across the wider network, which has meant that organisations such as yourself, or maybe those that you're working with, to write bids on your behalf. So there literally is no cost to any organisations in terms of us writing applications, because HSP have already paid for it. And as you will expect, bids are targeted very much about improving the use of physical activity for older adults across the county, by us writing bids on your behalf. So I think what's important to sort of talk about first of all is about who can apply, because a lot of activities as well that are delivered to older people are sometimes delivered by sole traders, and I'll come on to that. So like yoga instructors, for example, that might have their own business. So sometimes they can't apply. So first of all, it's important to know who can apply for funding. And so that ranges quite a lot from voluntary and community organisations and groups that are constituted. So have a governance document, or a constituted group that may have a chairperson or secretary, treasurer, a registered charity, a CIO, not-for-profit organisation, community interest companies, quite a lot of them at the moment, but also statutory organisations such as local authorities and such as yourselves, town and parish councils, as well as community benefit societies. Now, in particular, in relation to the service that we're offering, we're very keen to help organisations that are those that benefit older people over the age of 60, groups or activities benefiting a variety of groups, but just groups that are supporting older people to get more physically active. And that can be, and again, I'll talk about when I come onto the funds, but that could be a project that might be a particular event, so something that might be quite sort of short, to generate interest, to projects that go on for a longer period of time. Ideally, wanting to support projects that meet a need in the local area, so where there's a gap in provision, but also, obviously, just listening to things earlier, projects that might already be happening but need funding to continue to happen, or funding where you're doing something absolutely fantastic, but because you've created so much interest, there might be a need where the current group just cannot accommodate the numbers. So that might be putting on additional sessions. That could be sessions for the same group or those on a waiting list, or just where you might have identified particular times during the week where there's a particular need to run activities. So in terms of the fund in particular, we do focus on other funds, but in particular, there's two really good funds that bring in a decent amount of money to make sure that you can either deliver a regular session a week or a number of sessions a week. And the first one's the National Lotteries Awards for All. Now, what's good about this is that it funds projects all the way up to £20,000 and will fund them up to 2 years. So it could be that when you've calculated all your costs to run a session, it could be that you have a session that, by putting all that together to deliver it, might last up to a year. But what we tend to find is that we come across a lot of organisations, especially those working with older people, that might just run one session a week, and they might only need sort of 6,000 or 7,000 to run that over 2 years. But with the lottery, that enables you to do that. It's very good in terms of turnaround time. That you tend to get an application turned around in 8 to 10 weeks. And because there's no deadline, it means that you haven't got to rush any projects. You can think them through, make sure you get them right, talk to potential venues, decide what marketing you might need. So there's no pressure on you to sort of do that. However, when we start applications, we can ensure that, you know, we get them written for you quite quickly, so we can turn applications around normally in a week to 2 weeks. So what's important to know is what their funding priorities are. Well, a lot of physical activity, a lot of sport activities hit the first priority straight away, bringing people together and building strong relationships in and across communities. And again, I think just listening to sort of and before, you know, what is sort of one of the main key things is that a lot of projects that bring older people together is the fact that those social connections that are made. And so it's very much about sort of hitting that top priority. So most applications that we will do hits that one straight away. Improving places and spaces that matter to communities. We'll just sort of looking at the sort of there at the hub, you know, by putting on activities within those venues, you're improving the places and spaces that matter, because they do become hubs where people go to, not just for the physical activity, but for other activities as well. So again, a lot of the activities run within communities hit that second bullet point, enabling more people to fulfill their potential and do that at the earliest opportunity. We have done a lot of projects that work with particular groups of older people that might, for example, be struggling with dementia. It might be that they're living with Parkinson's. It might be that they have certain other health conditions. It might be that they struggle with mobility. Well, by putting on classes, whether that's around strength and balance, whether that's sporting classes, again, Anne touched on it, the differences it makes, you know, improvements to joints, you know, the feel less of falling, and just generally falling less, you know, that will help people fulfill their potential, because it might reduce anxieties, it might increase confidence, self-esteem. And by doing that, that will encourage people maybe who have been a bit scared to go out and go and do the shopping or other things. It enables them to carry on doing the things that they either used to do or want to continue doing, but feel afraid that they can't do them anymore. And again, last one, it supports people, communities and organisations that are facing the challenges that come with the rising cost of living. It's still and under that banner, the lottery still accept, you know, communities still struggling from COVID, because people are, and there's different variants. So, you know, a lot of people are still getting hit by that quite hard. And they were under that banner, even though it says the cost of living, they also are quite keen to support people that are still quite reluctant because of COVID to come back out and do community activities. So just by looking at that, any project that you've got that works with older people getting physical activity can definitely hit one or maybe several of those. In terms of strong applications, the lottery are always keen to focus on those that benefit the community. They're really interested in knowing how the community have come up with your idea so that it's community led. So, you know, people are saying, well, there's nothing in our community that's for older people, or there is activities for older people, but nothing that gets them physically and mentally active. So they are quite keen to know how your community has influenced your project. And obviously you need to hit one of their priorities. The second fund is Sport England. And again, Sport England are very keen on bringing community together, but also very interested in getting inactive people active, or people that are less active to become more active. And what we tend to find as people get older is they participate in physical activity less, or because they become less active because they might have had to have an operation, they might be low in confidence, that they are less active. So Sport England are very keen to support those people to be more active and use physical activity and sport to do that. They do have a priority about focusing on more disadvantaged communities, and by that they refer to it as the 30% most deprived. But what I've found is that if you have got a good project that is working with people that are regarded as a low participation group, which older people are, they are very keen to fund that. And they offer awards up to 15,000, again, available to not-for-profit organisations. They don't have a deadline, so again, there's no pressure there. And once you've submitted an application, they tend to work to 6 to 8 weeks turnaround. So in terms of the things that they will fund, I'm not going to go through all of those, but these just give you an idea of the types of things they will fund. And as you can see there, they're quite wide ranging. The key ones organisation seems to struggle with are somebody to deliver those sessions, to pay for the venues to be able to deliver them, to maybe train people up to come along, and marketing. And all those things are covered within both Awards for All and Sport England. The types of things that funders don't tend to pay for is routine repairs and maintenance. I have put on their existing activities or a repeat of regular activities, but they are starting to change that. And just with a little tinkering, you know, those applications, they are kind of much keener now to fund things that if you can demonstrate why you need them to continue, they will continue them. Day-to-day running costs, larger equipment, they won't fund fundraising activities. But as you can see from the slide before, there's the majority of things that you would need to run an activity through their funds. So just to kind of just give you a little bit of an explanation of what you would need to have in place. For Awards for All, you need 2 unrelated people on your governance. For Sport England, you need 3. You need a UK bank account in the name of your organisation with at least 2 unrelated signatories. You need a written governance document. That could be, if you're a company limited by guarantee, that could be articles of association. For a small group or club, that would be a constitution, and that your membership's open to all. So, and what it means by that is, yes, if you were doing a particular project, that you might just be targeting people that are over 60. But what that means is that if somebody does come along that's over 60, that you're not going to turn them away for a particular reason. And finally, I touch on this because organisations must be set up as a not-for-profit organisations, but we do get approached a lot from people that are delivering sessions and they want to deliver more or continue sessions, but they're sole traders. The key is if you can identify a not-for-profit organisation within your community, then you can just write that application through that not-for-profit organisation for those instructors, sole traders, to deliver them. And obviously these slides are going to be shared, but if you do want to find out any more information from the funders themselves, both have really good websites where you can find lots of information. or you can contact them by telephone or email if you've got any specific questions. So we've seen some, I've not been on that long, but I've seen some really good things already about existing projects. But I just want to share some examples just to show you the breadth of projects that have been successful as part of the Live Longer Better in Hertfordshire projects. So one of the early projects we did was stepping out with carers, and this was putting on walks for unpaid carers and people that they cared for who were either lonely, isolated, had health conditions, dementia, Parkinson's, and that's a project that's been very successful and is now actually getting spread out across the country in other places outside Hertfordshire. We did a bid for Hatfield Town Council, where we delivered 50 weeks of low impact exercise, anything ranging from seated exercise to light dance, short mat bowl, strength and balance. And that was particularly aimed at those that were at risk or at fear of falling. Through Hearts Coaching Association, we put in an application for a cancer exercise rehabilitation and support sessions for people living with or recovering from cancer. And those have been very successful. And I guess, although it would have been probably part of a different one, Anne's story just sort of reiterates the positiveness of those types of sessions. We did an application for Ash Valley Community Hub, running 2-hour weekly programs of physical activity and movement. And again, what you find with a lot of these activities, which was kind of sort of shown in the Apex video, is that the funders will fund the refreshments to tag on a social element to those projects, where people can just sit, chat, have a tea of coffee, some biscuits, again, to sort of help with that social side. Moving through Life CIC, we did something online, so something slightly different there, targeting those that are struggling to get out, we're suffering with long-term neurological degeneration conditions and illnesses, as well as face-to-face. And some of that almost worked on the basis of when people were getting stronger and better because of the online sessions, it enabled them to sort of move into sessions face-to-face. We've done projects doing Ortego exercise classes. In particular, coming back to sport, we did a really successful project with Hearts Fencing CIC that delivered 1-hour sessions, which were a combination of strength, balance and mobility, followed by doing a bit of fencing. We've done one with Hertsmere's Council, with an all year round bowling programme. And those go on and on and on. So just sort of, I guess, explaining the process of applying through Live Longer Better in Hertfordshire. First of all, if you've got an idea, but you're not sure if it's suitable, then the first stage is just to complete the online form, which you can do through the link there. Charlotte will come back to you, so you can discuss your idea further, or if Charlotte's already aware of it, she will send that to us once your project's been agreed. And then from that, we will send out a template that captures all the things that the funder needs. So, which in a nutshell, and it's not too onerous, it's just some organisational and personal information, a little bit about your project, the cost to deliver that project, a bank statement, and then the process of registering online, which enables us then to go in and write your application. And we would then do that. We'd share the application with you in draft. And then if you were happy with that, send it. And then hopefully within a few months, you get a positive outcome, which will enable you to go on and deliver your activity. And we're there to support you along the way. We can give you funding advice. We can have one-to-ones discussions. If you're part of a bigger organisation that wants a number of people to be involved, we can have a Teams call or a Zoom call and explain that in more detail. So it's very quick, but in a nutshell, that's what we do as part of this project. And there's my details there in case anybody wants to have a discussion with me regarding that. Over to you, Charlotte. Thank you.
That's absolutely ideal. Thank you so much, Richard. And Richard went through, as he said, a handful of the successful bids. I think currently we've had 36 successful bids since working with Richard for Live Longer Better projects, and we'd be happy to share more ideas if anyone needs them. And I'm pleased you covered that tea and biscuits would be covered on the funding, because that was one of my questions, actually, something that comes up in most of the meetings I have around funding. Can we include the social part element? So that's great. And I had another question. I was thinking after someone mentioned in the chat about their fantastic U3A. Do you know whether U3As would be eligible? Are they considered constituted groups, or is that an individual basis? Are you aware?
If they're constituted themselves, then yes, they can. So what you tend to find, it's not just with U3As, but sometimes you will have another good example is Age UK. But Age UK have Age UK Decorum, they have Age UK Hertfordshire, and so because of that, they are constituted separately, so they can apply themselves, and that should be the same for U3A. Because we have done U3A bids before for different areas across the country, and they've always been accepted. So yeah, they will
Great.
be.
Thanks, Richard. And Margaret just wanted to clarify what CIC was. So thank you, Kevin. It is a community interest company, and my understanding is that that's just a different way of setting up an organisation. It could be a charity, or you could be known as a CIC. So also, I think sometimes village halls have their own bank account and their own like governors, and sometimes they've been eligible to apply through this funding stream too. So there could be a few organisations in your area. Kevin has asked, will they do CIC by shares?
No, you've got to be a company limited by guarantee without a capital share, unfortunately. It's a strange one. I'm involved in an organisation that was set up with shares, and literally everybody had a £1 share, but because there is that £1, if you like, it's regarded as being for profit. So that is quite important, because sometimes people will set up a CIC, community interest company, and do it with shares, and that then stops you from getting the funding. But if anybody, I'm not an expert in that area, but because obviously I know what they will and won't fund, in based on your organisational setup, I can always have a chat to people about that and about how you would go about changing that.
That's great, thank you. Thank you so much, Richard. And I just thought I'd mention to everyone that on the feedback survey, there is an opportunity for you to express your interest in the bid writing service. So when you fill that in, please express yes, and then we'll get in touch. And I suspect we'll be able to share that form with them, so they're able to potentially show that to the Town and Parish councillors as a group, and they can see what is kind of what they need to gather for Richard to help write your bid. Okay, so we are now moving on to our Q&A section. So if anyone's got any questions about covering any of the speakers that we've seen today, please do include those in the chat. Thank you ever so much, Richard, because it's just so useful. I feel like your part is the most tangible thing that people can really use to help make a difference in their community. So appreciated having you here today. Now, I've put on the screen a QR code to the survey, and you should also be able to click that forms link, and it should take you straight through to the online survey. I think there's about 7 questions. They're just short questions to gather feedback from the conference. As I mentioned, we're at the beginning. This is our first time doing a Teams webinar, so your feedback on that would be most appreciated. And then we can look at some questions. I'm just going to have a look myself. I think Margaret asked a while ago about the grants and the funding, and I think we've been able to cover that. And in terms of youth, Margaret, so the Live Longer Better in Hertfordshire bids cover activities for people aged 50 plus, because we want to focus on that prevention piece as well. And if it was something in particular for children and young people, you would be able to use Richard's services privately and write a bid that way. I think we'll leave the question and answer open for another 20 seconds or so, or if anyone wants to raise their hands, if typing in the Q&A is proving difficult, but I like to think that means it's been rather comprehensive. Hopefully a lot of food for thought. Thank you to those who've already reached out to say that they would really love to get involved and bring some Live Longer Better activities into their areas. Thank you so much. And I really appreciate everyone's time today. Thank you to everyone behind the scenes who's helped with the technology, who's helped answering queries. Thank you so much to our speakers. You've been so inspiring, incredibly useful. And most importantly, thank you so much to our councils who are on the call. We're absolutely indebted to you. You have a real impact at a place-based level. And we know that's where change really happens. So I just want to say a massive thank you to you for all the work that you do selflessly all the time for communities. And if we can do anything to help you, then it would be our pleasure to do so. I think that might be where I draw the conference to a close. Have a really wonderful rest of your day. We will share the slides, we will share the forms, we will share the Kahoot statistics. You can share those far and wide. And I hope to catch up with you soon.